Hi, my name is Michael Cramer. I'm a cancer survivor and I live with chronic GVHD. And thank you guys so much for interviewing me today. I'm excited to share my story and hopefully inspire some people and spread some positivity.
Yeah, as a start, because not everyone, of course, is aware of your story, your background. Perhaps you could share a little bit about your journey in the last 4 years from your diagnosis to where you are today.
Yeah, so when I was 19 years old, I was a freshman in college. I was athletic. I was in the gym a lot. I grew up a windsurfer and sailor. Actually, was on the Olympic development team. We did a lot of competitions around the world, locally, and I had a pretty good life, and I was always healthy, always in the gym. I was a surfer. I loved the ocean, the water. I loved just being very active. And when I was 19, it was 2020, and it was around March that the COVID lockdown had begun here in Miami, Florida, and they started to close the beaches, the gyms, everything. So we were pretty isolated, and not much was happening, and I started to feel pretty tired. I thought it was just because I couldn't do my normal activities. I wasn't having much of a social life. So for a few months, this just kind of stayed like this. No severe symptoms. I was just really tired. And then it was around the beginning of July, the end of June of 2020, when I started to develop some fevers. And previously to that, I was having night sweats. But it was summer, and I was living in Miami, so I thought that it was just because the sun was coming into my room in the morning, so I'd wake up sweating. And I didn't take it as signs of cancer or anything, but it eventually was cancer. And I remember, just feeling so tired. Like I was tired for a few months, but then it really got horrible, like towards the end of June, beginning of July. And that's when my mom and I went and I met my pediatrician. At the time I was 19 and she was still seeing us till we were 21. Did some blood work with her, and then she referred me to a specialist at a hospital nearby, a blood specialist, and he did some blood work of his own, and then he asked us to spend the night in the hospital to do a bone marrow biopsy in the morning because the blood work was bad. And we actually didn't spend the night. We asked if we could just come back the next day. So we came back the next day. He did a bone marrow biopsy, and he told me I had leukemia or lymphoma. And then it took them actually 4 weeks to officially diagnose me with hepatosplenic T-cell lymphoma on August 3rd of 2020. And immediately I was admitted to the hospital. I had a port placed in right away when I was diagnosed. And I stayed there for a week, but then I was discharged, and 3 weeks later I got my official diagnosis. And when I was diagnosed officially, we started chemo right away, and I immediately knew a bone marrow transplant was part of the process. They told me straight away that I was going to have to get a bone marrow transplant, and I did 3 rounds of chemotherapy that were really intense and aggressive just to destroy my cancer as quick as they could. And when I was in remission, we did a BMT. So on October 27th of 2020, which was yesterday, it was 4 years since then, I had my bone marrow transplant, and my mom and I, we were in the hospital for 6 weeks for that process. It was a long process to get a BMT, really intense chemotherapy, radiation, and I was very sick. I vomited countless times. I had PCA pumps for morphine because I was in so much pain from all the mouth sores and everything that was going on with bone marrow transplant. And after the BMT, we finally went home, and I actually developed GVHD pretty immediately, which is graft versus host disease, which is when the donor stem cells from the BMT start like fighting your organs and kind of rejecting your body. And ever since then, I've been dealing with GVHD. I actually live with chronic GVHD. And there was a point where I was in the hospital. My mom and I were in the hospital for like 5 straight months because of how bad the graft versus host disease was. It was really severe, and thankfully, I'm not admitted to the hospital anymore, and I'm doing much better nowadays. And I still live with GVHD, but it's a lot more manageable nowadays.
That's good to hear. And are you able to do more of your hobbies, of your activities that you love doing? So back to a little
Yeah,
bit of normality.
I've been able to get back to some of them. It's not the same as before, as my body has been through a lot, and it's a little weaker. than it was before. I can't really get sun. So there's a lot of stuff that I'm more limited on doing now, but I can still do the things I love, which is great.
If you look back to, well, the beginning, because you're saying
Yeah.
that it took you a few months, of course, to first go into to the doctor and see if there's something deeper than just fatigue going on.
hmm
What do you wish that you had known when you were first in those early stages? Would you have done something differently?
Honestly, I don't know. I don't know if I would have wished I would know anything because I don't know. I mean, maybe I wish I'd. I don't know. I honestly, I've never thought about that. I think that I went at the appropriate time, but because I was healthy, I never had any health issues before, so me being tired in the COVID lockdown was kind of not a huge deal for me at first. But if people are experiencing symptoms out of nowhere, like night sweats, and you're tired and you start to get fevers, you probably should go to the doctor just to see what's going on if that's not normal for you. And that's what we did when it dragged on, because that's when I realized that I wasn't feeling like myself at all. So if you are experiencing symptoms like that and it's not what you normally feel, then you probably should see the doctor and check out what's going on.
Yeah. I can imagine also that because you've had to go through a cancer diagnosis and cancer treatment at a very early age, so that's normally not when you suspect that what you're
Right.
experiencing might be related to cancer, I suppose. So, um, in the fact that you've had to do it at the age that you've had to do it, has it in any way impacted you in terms of, well, how you were able to maybe advocate for yourself during the treatment, what to ask for, what to expect, how to deal with the whole process?
Yeah, I think if I was younger, like a kid or something, I probably wouldn't have asked as many questions, but I was 19, so I was pretty self-aware and understanding of what was going on, so I asked a lot of questions, and I really wanted to know what was going into my body, how it was going to affect me, what I was going to feel like, what to look out for, and if that the treatment option they were giving me was the best treatment option available.
It's important to ask these questions indeed, and it's actually well, it's positive for me to hear you say that you were able to do this already at this age, because you say if I was younger, but I mean 19 is also quite young, so not a lot of people at
Yeah.
19 would know to ask the questions that need to be asked. And for you, your story and the message that you're putting out there is a message of maintaining a positive mindset, of working through the dark parts. Um, but there have certainly been some challenges, I suppose, in your dealings with the healthcare system, or maybe there haven't been. That's also, of course, a possibility. Hopefully, that was the case. But was there anything that you experienced that you faced during treatment or dealing with the healthcare system that you would say this has to be improved, or this doesn't work, or maybe it doesn't work for younger patients?
I mean, I would say the biggest issue is like insurance and cost of treatment. A lot of times, when I was diagnosed, I had to get a whole different insurance because I had insurance through my college, but I had to stop college because of my diagnosis. So I lost the insurance, had to find a new one, and basically, right now I'm on Medicare. And if you're on Medicare, you have to like be you can't really make money and have insurance that covers the cost of treatment. So it's very difficult even now because I'm still doing treatment every few weeks and I'm still taking prescription drugs every day for my graft versus host disease. So, the issue is it's you have to jump through all these hoops to get insurance and qualify for insurance, and there's all these issues that come with the cost of drugs, and then also to get to the drug that I'm on now, I had to fail a few lines of treatment to get to it. And that's because that's just how it is right now. But if I had known that this drug was going to work better than the other drugs, and I had to try all these other drugs, I, I wish I knew that this drug would have worked. In the beginning, I had to try steroids and this drug and that, and the last line of treatment for me was really this drug, and it was pretty much the last hope, and it worked. And if I'd started that earlier, possibly I wouldn't have to have gone through everything I went through. So, I mean, you don't really know that, but you think about stuff like
And
that.
have you had to, well, proactively ask for more treatment options on the table or different treatment options with your healthcare team?
In the past, it was more. Now I'm pretty stable, so but we are looking into new immunotherapies just because my GVHD isn't amazing. My liver is still not doing great, but it's not bad like it used to be. But yeah, in the past, none of the treatments were really working, so we were trying a bunch of stuff, and this getting to this drug was like didn't even know if this they didn't think this drug was going to work. They just kept trying like the main line, which was steroids for GVHD, and steroids weren't working. And yeah, I mean, I wouldn't have known that this drug would have worked, but it was there, and it was like the last resort, and it could have been something we started earlier. And it's very complicated because who really knows what works, and it could have just been lucky with the timing. But yeah, it's a complicated experience when you have a disease that is very complex and affects multiple organs in the body.
I'm sure it's not a black and white
Hmm.
situation indeed, and what works for one person might not
Right.
necessarily work for the other. So that's always good to keep in mind. Um, for you, well, it's clear that you have worked a lot on maintaining a positive mindset, and that's what inspires a lot of people to follow you, to be around you. What would you give as advice or a message to patients that are hard to move through the darker, let's say, mental side of their treatment?
Yeah, I think that my message would be that like cancer or GVHD or whatever treatment, whatever disease or health issue you're dealing with, there's times when it seems like it's never going to get better. There's times where it just seems like it keeps getting worse, and that there's not much hope because you've been going through it for so long. And I was at that point once. And then when you reach that low point, it's like it feels like there's no getting out of there. But if you could see the future and realize that there is hope and that there is something to look forward to, and if you can just put something in your mind and be like, okay, who knows? What if this next treatment works and I can end up doing this? Like, I'll be so much happier. And if I knew personally that my life would be like this 2 years ago, I would have not been as sad and as depressed. I mean, there was a time where I wanted to give up and stop treatment because it was so hard. And knowing what I know now, it's crazy to think back to that. But at the time, life was so hard. So my point is, there's always hope. There's always hope for the future. There's always hope for new drugs developing. There's always hope for something to change your life and give you a different perspective. And that perspective also comes from within. You have to learn to, deal with the anxiety, deal with whatever it is you're going through, and just keep going and try to find the positive things in each day.
Yeah, I think that's a very important message. I mean, thank you for sharing that. What overall, I mean, what role has for you personally mental health played in your recovery? I think that's well, what importance do you give to that um, in combination with, well, the more technical part of the treatment?
Well, mental health is everything. I think that if you're not feeling well mentally, you're not going to feel well physically, and it goes both ways. Like the physical impacts the mental impacts the physical. I mean, there are times when, of course, your mental won't like cure your disease or anything like that, of course. But if you have the mindset of a growth mindset and trying to see things from a positive perspective, you're going to see things from a positive perspective, and your life will be better. Mental health has been huge for me. When I was diagnosed, I started therapy immediately because that was offered at my hospital, which was really key for me. It was great to get in contact with a therapist, and even now I'm still in therapy because I have a lot of trauma from what I've been through, and it's not been an easy journey, not been an easy experience. And I think taking care of your physical health, is taking care of your mental health. It goes both ways. Like by being active, you're taking care of your mental health. By doing something you love while you're in the hospital, like I would build Lego or I would go on little walks. Like that takes care of both, and in a way, you can integrate it into both things. Like meditation is good for your physical health because you're focusing on breathing and you're calming down your nervous system, but that's also mental health. So it really goes both ways.
It's, yeah, I agree with that. But it's unfortunately a lot of healthcare systems around the world don't necessarily. I mean, they may see it that way, but they don't necessarily offer both types of care in combination. So it's a
Right.
way
Yeah.
to. Um, so it's another element where patients should, or where they can be proactive into integrating
Hmm.
caring for themselves, for their mental health alongside the rest of the treatment. And I mean, being a patient, it's always like patients are people, of course, but this term it always comes back, of course. Um, and you sometimes, I suppose, can feel as a receiver of advice, treatments. Maybe it can affect your sense of agency. I don't know if you can relate to that, but is it were there moments, or can you share an example, a moment that you felt truly empowered as a patient? That was you felt like you were not simply well a passive recipient of other people's expertise or advice or guidance.
Yeah, I'd say it's been more recent that I felt that way, because I think for the first like 3 years in dealing with cancer, I didn't really know anything about cancer treatment. I don't expect anyone that doesn't have a background in healthcare or a nurse or doctor would really go into being diagnosed with cancer and know what the best treatments are for your cancer. But when I was diagnosed with cancer, I just was listening to doctors, same with GVHD. And then it started to become more recent in the last like year or so when I started really understanding where my disease is and kind of telling the doctors that less treatment for me would mean more time possibly in the water, and getting my knee replaced was something that could also help with me being more active. So it really started to get to a point where the last year or so my quality of life has gotten better and I'm more understanding of choosing quality of life, over, the just yeah, I listen to my doctors, of course, but we try to advocate for as much quality of life as I can in my life, and that's been really important when you're going through something like GVHD that's a long-term illness, is trying to get the best out of your treatment, but also trying to live as much as you can. And that's something that I think most patients should strive for when going through treatment for like a long-term disease, is not just letting the doctors put you on whatever drugs they want, but questioning why and seeing if there's like a better option that could help you live a better life is always a good thing to ask your doctor, because they might put you on something and you might not say anything, but you hate it, and there could be another option. So it's important to just like ask your doctor if there's like something better you can do, or a different treatment that could, you know, give you this type of advantage with your quality of life. It's just important to talk to them and ask them questions and see if there is something that could be better
Yeah.
fit for you.
Has arriving to this point, has it required a lot of research on your side, just spending time to understand the options yourself before you bring them to the table, or what was your approach to it?
Not as much. You would think more, but it's more because my case is so specific with my liver, GVHD, my skin, my mouth, and my stomach is really what's affected. It's more like the doctors would come to me and we'd talk about what treatments I'm going to be on, because there's so many treatments online, and a lot of them I either don't qualify for or they're not, like they wouldn't help me. So it's more like the doctor comes to me and we'll talk about treatment options, and then I'll see what I think would work best for me.
So yeah, the collaborative relationship basically is important here. Yeah,
Right. Yeah.
yeah, it's really important to have the right team with you.
Mhm.
um, well, do you feel that again? In my mind, this is again related to your age and how you've had to experience what you've experienced it so early on. But did you feel that your friends and your peers were understanding your situation? Has has it impacted your support system of people around you?
I don't think they understand my situation. I still don't think they understand my situation. I think that my friends in the cancer world who've had cancer and the people I've met online understand my situation. But my friends that I'm close with now, like just and before cancer, no. Maybe like one of them understand, but not really. I think the only people that really understand are like my mom and my doctors and other cancer people I know.
And has it, well, maybe it's too personal, you don't have to answer, but has it cost you any friendships or any loved ones to be in a situation if they weren't able to, well, adequately react?
Honestly, honestly, not really, because all my close friends I'm still close with, and the people that I wasn't really close with before, I'm not really friends with anymore, and that's they were never like my real friends, so it's not like a big deal to me. But my close friends that cared about me and I cared about them, we're still good friends, and it doesn't matter that I've been through this and have this disease. They don't care.
That's very valuable.
Yeah, it's valuable.
And well, also sharing your story has brought in a large audience of, well, I'm guessing largely so other patients or caretakers, people who are closer to your situation. Um, have people reached out with stories that would, well, they probably have, but what I'm trying to get to is, is there a specific example or of a surprising or touching or eye-opening story that someone has reached out to you from around the world?
Yeah, there's been a lot. A lot of people have reached out to me with like crazy stories, and it's more common than you actually think. It's pretty insane. I've met a lot of people online who actually have GVHD and people who've actually had similar, like the same cancer diagnosis as me, and my cancer is quite rare, and a few of them ended up not making it, and it's been tough. Like I had a few friends who actually had GVHD and cancer, and two of them actually passed away recently, and someone who had a similar cancer diagnosis to me that also passed away. And there's been people who've also just had like crazy health stories. Like I try to open a lot of my direct messages on Instagram when it comes to people who message me about cancer. So I've talked to a lot of people who've had cancer, and I've heard some really, really great stories. And I lead a support group for cancer survivors and cancer patients every week. So I get a bunch of people coming in there who have really similar stories to me, and it's awesome to see that and just hear about them because a lot of them are actually people my age. So to see people get their life interrupted like mine was by cancer was really like heartwarming in a good way. Not good that they got cancer, but like, made me feel like normal, and that's just so
Yeah.
beautiful to see that.
And you lead that support group online somewhere? Is that publicly accessible?
Yeah, it's publicly accessible. I actually do it on Discord. I used to do it on this
Yeah.
app, a different app, but they started charging people to join it, so I quit it because I don't want anyone to have to pay to join a cancer support group because that's just not
Yeah.
right.
Yeah, I get it. Okay. Yeah, that's a great initiative, and yeah, I'm sure that it helps also others to feel like they're sharing this experience with someone, not that they're alone in it. Um, and if you, I mean, you're someone in your early 20s. I know that sometimes because we every day communicate with people who are, going through all kinds of things. Sometimes it can get strange to me that we keep on referring to cancer journey, cancer warrior, all of these terms that have become now almost a given when you're discussing someone's situation. How do you feel about that terminology? Is that something that feels, that feels right, or is there a better, more genuine way that you would prefer people would talk about it?
Yeah, I think it depends on the person. A lot of people like to use the word like fighting or battling, and I always say that I don't love those words. I kind of I think the words are tough, because it is a journey with cancer. I think it's more of a journey than like a battle. I think battle is not not a bad word, but it's not like a good word either to me because it's like you're battling something that's within you. Like cancer is inevitably it's a part of you and you want it gone, but fighting something inside of you just feels wrong to me. It feels like it's part of you, not for a reason. That sounds wrong to say, but it's there. And when you say accept cancer, it kind of sounds like you're surrendering, but you're not surrendering. You're accepting your circumstances and just moving forward. And I always think acceptance is the word to use when it comes to things like this. But people, the thing is, people tend to respond well to, when you say you're fighting cancer, people think, oh, yes, like rock on, it's empowering. So there are times when I will use that word because people like it, and it's, I don't like it personally, but sometimes people respond well to, having the power, like you have power over cancer because you want power over it. But in reality, you have no power over cancer. You can't do anything specific to survive or not survive. It's really just all down to treatment and luck. It's one of those things that no one has control over, and no matter how hard you try to control something like that, you just have no control, and it's more about accepting what's happened to you and just moving forward as best as you can.
Yeah, coexisting with cancer.
It's
I
a
like
what?
that. A coexistence.
It's like a coexistence, and you'll do everything you can to get rid of it. But I yeah, exactly. You just have to accept it and do what you can.
Yeah, that's a good point. And well, where does Michael want to be in the future?
Where do I want to be in the future? I want to be doing motivational talks with my mom, doing more social media stuff. Just I think that I've struggled so much and I still struggle a lot. And I think that all of this is just, I think my life, I want to devote my life to just helping other people. And that's what we're doing. And that's what I'm doing by being interviewed by you guys and posting on social media and just fulfilling the dream of helping people because we've been helped so much and I've suffered so much. And there's always kind of something going on with my health. And I truly believe that I was put through this to show others the way, and that's just the way I see life. Is I want to help people, and that's all that it is to me. It's just helping people.
Would you say that's your mission?
Yeah, that's my mission for sure.
That's good. And yeah, as maybe as a closing, do you have any message to people who reach out to everyone at work who are struggling to access treatments that they could potentially help them but are not available in their home countries?
Yeah, go to everyone.org and learn about these amazing people who do this amazing work. Like seriously, and also talk to your doctors because there's there are so many resources and doctors are very well connected. Like they went to medical school and they have friends in like other parts of the country at different hospitals that know different treatments and they probably have friends all over the world. So genuinely talk to your doctors, do your research, find out what's available for you because chances are there's a second line of treatment. There is a second option. There's always like another doctor that will be willing to look at your case differently than your current doctor if it's not working out for you. So just know that there are a lot of resources out there and also for support as well. Like if you want mental support, like find a therapist. There are online resources. There are support groups online. There are communities of people with diseases that will be welcome you with open arms. So just don't forget that. There's so much support out there. It may not be easy to find, but it's out there.
Just don't give up, I guess. Keep
Yeah.
looking. Yeah. Thank you.